Good afternoon, ladies and gentlemen. It's always difficult to negotiate this post-lunch session, especially when you have a non-clinical subject, topic which does not interest the audience. So it acts as a mild sedative. So let's see how we can keep you awake. The topic may not be very interesting, though Vidya was saying it's a very interesting topic, but it's a very pertinent, very important topic. So this is about the dream we have from AFPI. It's a vision of AFPI to have clinics which have certain standards and prepare these clinics for accreditation. So in the last few years, the healthcare sector in our country is witnessing a very rapid social, economical, and technological advancement. It has attracted major international healthcare players in the market. And we also see growth of small healthcare clinics and ambulatory centers here and there. Primary healthcare and primary care clinics being an integral part of the health sector, we cannot be left behind. Having said this, it's very unfortunate that the primary healthcare sector in our country is neglected, I must say. It does not get the due importance which it deserves, both in the public sector as well as in the private sector. There could be many reasons for this. I feel it's because the primary care sector lacks standardization, inconsistency in the facilities and licensing of the professionals. At one hand, at one extreme of the spectrum, we have the Ayush practitioners practicing in a small place. We have own MBBS doctors and even the specialists, they're practicing in 10 by 10 small clinics, they're managing their own clinic, they don't have a place for patients waiting, they don't have the other facilities which the clientele expect, the patient expect. On the other end of the spectrum, we do see some of the clinics which are the corporate clinics which meet all the standards of the NABH and the NABC. But there's a huge gap between these two. So we need to fill this gap and bring these two together and develop some standards which are achievable. Although we have standards for primary care clinics in our country, these are not acceptable, not accessible, and maybe people are not aware. Till very recently, I myself was not aware that NABH has developed standards for primary care clinic. They have a beautiful set of standards which they say if you attain this, you will be accredited. But I don't think any of the primary clinics so far has been accredited by NABC. They call it as NABC. But I feel the standards developed by NABH are a little too exhaustive for a small-time practitioner or a small-time entrepreneurs of primary care to achieve. So we thought, so before that, let's see why we need accreditation. Health departments can no longer afford not to be recognized by the public. So only if our activities are better understood by the public will our functions be appreciated and valued. I think we all agree with this. High performance and continuous quality improvement, it is a must. In these economic times, it's becoming increasingly vital to show more bang for the buck and continuously improve health department functions. So there lies the need for accreditation. There are many definitions for accreditation. I'll not go into the details. Accreditation, simply put, is an approach used by many healthcare and social service organizations designed to improve the client outcomes and healthcare system performance. It helps the entire organization work together to create a focus on safety and quality. That's the most important things. Safety of the patients, safety of the care provider, and the quality of care. So let's see what are the benefits. Benefits for the patients, I think among all the stakeholders, the biggest beneficiaries are the patients. They are taken care of by the quality care providers. The patients are serviced by credentialed medical staff. The rights of the patients are respected and protected. If you have a system of accreditation, the patient satisfaction is regularly evaluated. This is one of the continuous process of accreditation, the constant evaluation and monitoring of the care and quality provided by the caregivers. And as far as benefits to the clinics is concerned, accreditation to a clinic stimulates a continuous improvement. It raises community confidence in the caregiver and also provides an opportunity to the healthcare unit to benchmark with the best in the sector. And it definitely gives a sense of pride among the caregivers. For the clinical staff, it provides a platform for a continuous learning, good working environment, leadership, and above all, ownership of the clinical processes. You feel pride that you are owning a clinic which has been accredited by NABH. It improves overall professional development of the clinicians. And most important thing is the benefits to paying and regulatory bodies. This is very important point. See, if you don't look at, if we, the primary care providers, if we don't look at this process at this stage, probably we'll be taken over completely by the tertiary care corporate bigwigs. They're already moving into the primary care sector. I can see the developments in the urban areas where the tertiary care hospitals are coming out with satellite clinics all around their clinics. You know what is their agenda. And I was wondering why these things are coming up so rapidly. So I had interaction with few the insurance companies. So the insurance companies, the health insurance agencies, as of now they are covering only the inpatient care. But they're not happy about it. They're not doing well. So they are thinking of covering even the primary care in their health insurance schemes. So this has been sensed by the tertiary care corporate sector, and probably that could be one of the reasons. This is my perception probably, and even during my interaction I could feel that they have shown interest in these insurance companies, and that's why they are getting into the primary. So this is the time, probably this may happen very soon, maybe in a matter of 1 or 2 years, couple of years, probably the insurance cover will be extended to primary care. So we must exploit this, we must utilize this opportunity to our benefit. And it is in the interest of the primary care providers as well as in the interest of the society. So what is our vision? What is our dream from AFPI? Is to have a set of clinics owned by our own members to start with, which will raise to the standards of NABH. Having said this, it's not easy to achieve the NABH standard. So what I am proposing, what we are proposing is to develop standards which are easily attainable, easily achievable. And maybe we can have a process of AFPI certification. Initially, we'll have AFPI certified clinics. We can have a bigger, wider network of AFPI certified clinic. And definitely, yes, since NABH is an accepted accreditation institute, and they have vast experience in this, and we'll help these certified clinics, AFPI certified clinic, to attain accreditation by NABH. This is what we envisage, maybe probably in the next few years to come. So the ultimate goal is to have a chain of AFPI accredited clinics owned by qualified family physicians. So we have the resources are available with us. There are so many. I was really surprised to see when I was just surfing through the accreditation process in the other countries. Most of the Western countries, even the Middle East countries, even developing countries have their own standards for primary care clinic. I don't know why in India it is still not accepted and it's not being followed. So we have various resources from which we can take the standards. But for the time being, I think NABH standard is good enough. Probably we can take the broad guidelines from the NABH standards and then have our own standards, AFPI standards. So the outline, broad outline, I'll not go into the details. It basically covers the access, assessment and continuity of care. That is one area. The facility and equipment is very important. Patient rights and education we cannot ignore. Management of information, it's very, very important. And the electronic record system, this is going to be mandatory for all the clinics to have a EHR system by the EHR regulatory authority. That's why probably we are planning to go and sign an MOU with some of the agencies, maybe with the DWISE, which is already there, which has partnered with AFPI in this conference. So we'll have a common EHR system amongst all the AFPI certified clinics. Infection prevention and control of patient safety point of view, and even from safety point of the care providers, very important. Medication management, laboratory services can be optional, but I feel we must include the laboratory services in whatever stage, like maybe in a very small lab within your own clinic premise. And community participation integration, this will have to deliberate whether to include this, because this will involve a lot of other issues. So what we intend doing is to form a technical committee in the AFPI, and the clinics can volunteer. We are going to publicize this in our website and other social medias. All the clinics, the interested stakeholders, they can apply to AFPI on the prescribed application form, and the clinic shall be able to demonstrate to AFPI, they assess on the AFPI assessment team. We are going to make assessment team like NABH has their assessment team region wise. So probably initially we'll have just one technical committee. Once the demand increases, probably we'll have the regional committees. So the applicant clinic will apply for all the facilities and services being rendered from the specific location. And NABH accreditation will be considered only for the clinics which have been certified by AFPI. This is what we are going to propose to NABH. In fact, we had 2 panelists from NABH participating in this session. Unfortunately, due to some last minute engagement, they could not come. So we had an exclusive session for NABH standards and how we want to partner with NABH. The financial terms and conditions, we don't have any interest. It's all free of cost. General information brochure will be available on the website, free of cost. Standards, AFPI standard for clinical accreditation, that will also be available free of cost. Maybe we might charge only for to cater for the travel and accommodation expenses of the assessment. It will be very, very nominal. Okay. So we also have the outsourcing options. We are thinking over it, whether to have own committee, because most of the members are all busy practitioners. I don't know whether they'll be able to give that much time for this process. So we can think of outsourcing it to NABH, even for certification also. We have some other agencies we have shown interest, like Safe Care Standards, and there is one agency in EU Primary Healthcare Standards. They are Bangalore based. So we are in touch with them. We'll see how it goes. So in the first phase, we want to have 8 clinics as a pilot project, maybe in Bangalore or in Delhi. And we'll try for test branding and marketing strategies, working on referral network. We'll try to establish a network. And maybe in the next phase, we'll try to grow further, build a network of maybe 60 clinics in the second phase, and then try to expand. This is what is the plan and roadmap which we are proposing. If you have any better ideas, please share with us at the end of the session. I think we have already gone beyond schedule. That's why we have been asked to curtail the session to 30 minutes. It was a 1-hour session. So I'll now invite Dr. Jaya Bajaj to share her point of view and her experiences. She has practiced in UK. She was manning a clinic which was accredited by the US agencies. So I'll request Dr. Jaya to share her thoughts. Thank you.